People, how are you doing? It is Dr. Doris, and I am here to talk about the challenges that I have faced as an international medical graduate working in Australia, and the challenges that you might face as an international medical graduate working in Australia. If this looks like a topic you're interested in, please do hop in. Let's talk about it, okay? And then this video is for you. Okay, guys, let's talk about something interesting. I know that a lot of IMGs might be interested. The first one is having to go through the exams, the Australian Medical Council exam. I mean, the stress of studying for the exam and putting yourself in a position where you know that you have to pass. I mean, the only option you have is to pass the exam, because passing it is the first initial step that will help you to move forward in your career. So that is the number one challenge, the exams. Then the second challenge is navigating the jobs. I mean, preparing your CV, your resume, looking for agents that can help you to get into Australian setting, trying to join a lot of the subscribe to Seek, Indeed, Jora, all those things. The time you spend looking for job, these are challenges. Okay, and another challenge is the rejection that you get. Trust me, if you're applying for a job and you haven't gotten any rejection, then you haven't started application. I'm telling you. I mean, rejection is part of the process. It is very stressful for you to keep on applying for this job and getting so many rejections. But like I said in my previous video, do not let the rejections discourage you. Do not let them be the reason why you stop applying. I listened to one of the video that one doctor was making, and he was saying that, oh, he's thinking that it's gonna be more difficult for doctors to get job in Australian setting, because there are lots of doctors that are passing the Australian Medical Council exam, and the Australian health system is becoming saturated. Anyways, I'm not countering that opinion, but what I'm trying to say is everybody's luck is not the same thing. That this person actually didn't get does not mean that you will not get. So you shouldn't bring yourself to the level that you say to yourself that I have given up, or that because they said that it's gonna be more tougher to get job doesn't mean that you will not get. The only thing you can do is to prepare yourself as a medical doctor. If you're back home working as a medical doctor, get skills, acquire skills, relevant skills that are gonna help you to thrive in Australia. What are those skills? Like collaboration. You know how to work in a multidisciplinary environment where you have to refer cases to consultants, to the registrars. You know, you go to different departments, from department to department. You should prepare yourself on how to do that. The next one is prepare yourself on how to be diplomatic. I mean, in Australia generally, I have also found this as a challenge. Using the right language that doesn't offend the people that you are working with, or that doesn't offend the people that you are treating, which are the patients. You need to know the languages that are appropriate to use for patients. So some things that are normal in your place might not be normal to Australians. So it's kind of a cultural shock to me, because I mean, when you see a young child that is about maybe 12 years old and you're referring to that person as a child, they look at you like, I'm not a child. But actually, in our place, anybody that is less than 16 years is a child. But you cannot specifically or outrightly say this is a child. You need to look for the appropriate language. So what I used to use is young adults or teenagers, you know, because before, when I first started work, I'll say, oh, this child, and they would look at me, I'm not a child. And I'm like, oh my God. So this is one of the difficulties I faced, like having to learn the appropriate language, the right way to address the people you're managing and the colleagues, you know, your other colleagues. And remember, some of them are from different cultures, different nationalities. There is diversity. So one of the challenges is having to understand what this culture accepts, what this culture does not accept, the right way to talk to this person, the right way for this person not to feel offended. So that was one of my biggest challenges an IMG. So navigating like coexisting, cohabitating, adaptability. That was one of my biggest challenge, and I think that any IMG coming into Australia will have that same challenge. So the next challenge that I had is transitioning. Okay, transitioning, because sometimes back home the way that we manage some conditions is quite different from Australian management schedule, and that is why you needed to write their exams, because then it will help you to understand their guidelines, what they do and what they do not do. But those things are theoretical. Trust me, when you study something, you have the theoretical knowledge of it. So the main challenge is now practicalizing what you have studied in Australian setting, where you know that there are lots of litigation. Okay, so this was another challenge that I had, putting them into practice. That is the transitioning process, which I believe every IMG would have that same challenge. Then the third challenge was communication. Some nationalities, when they even speak to you, you can't really get what they're saying. Either they're too fast or too slow. I don't know. So, but some people will talk in a very clear tone. You will understand what they are saying. While some other people, when they talk, you really need the grace of God to understand what they are saying. And then you have to keep on interrupting them and like, either can you go slow, can you say that again? And I mean, it makes conversation to lose taste, you know. But this is one of the challenges I also faced. Although I'm not yet fully into this particular communication one, but I am gradually trying to adapt myself to it, you know, because I have known that this is one thing that I need to do. Another thing you need to know as an IMG is, like I said before, learn skills. If you're gonna be wanting to work as a medical doctor, very important skills that you need, hands-on skills you need. You need to be very good in IV cannulation. You need to be extremely good in IV cannulation. That is a very important procedure. Drawing blood, that is phlebotomy. You need to be very good in it as well, because those are procedures that you do every day in the hospital, in the GP practice. Even if you're in the GP practice and the lab person is trying to draw blood and they have difficulties, because you're the doctor, they are going to call you to come and help them draw blood. And if you have to set line, let's say in the GP practice you have to do iron transfusion or iron infusion, you need to be the doctor to cannulate the patient. That is also being done in the hospital. So you need to have a good hands-on knowledge. If you are good in hands-on, keep on doing it. All these suturing techniques. If a patient is coming to your practice and the patient has a very rugged-looking injury, maybe you can see the bone. So you need to actually wash and clean the bride and suture if it is necessary. So you need to know how to do your basic primary suturing, as well as even in the hospital setting, there are some emergencies that you would require to suture quickly and send the person back home. So all those basic techniques that are life-saving are very important. You need them. And again, if you're looking for a job in Australia, one thing I advise you is there are free CPD courses that are relevant to Australian hospital. You need to do them. You need to do them. I think I'm going to attach some of the link for free CPDs on this video. If I don't do it, if you listen to now, please remind me. I'll attach the link here so that you can easily click on it and get some free CPD courses which are going to be relevant in your job search. So those are the basic challenges that I have faced. Racism, I don't think I've experienced racism in Australia. In as much as I know that some people might be secretly racist, but they do not show it out, because Australia does not even tolerate racism at all. They don't tolerate you racing against another human being, because this is one good thing about Australia. They believe that every human being is equal and have every right to exist on the same level. So these are the basic challenges that I have faced, and I hope that this video prepares you, because you are going to be meeting these challenges if you come over Australia to work as a medical doctor. So thank you so much. I wish I have been able to inform you, and I will see you in my next video. Remember to give this video a thumbs up. Bye.